Breast cancer is a type of malignant disease that occurs when cells in breast tissue grow abnormally and uncontrollably. Normally, cells in the human body follow a regulated cycle of growth, division, and death. However, in the case of breast cancer, this process becomes disrupted. Cells fail to die as they should and continue dividing in an unregulated manner, forming a mass or tumor. If not detected and treated promptly, this tumor can invade surrounding tissues and even metastasize or spread to other parts of the body, such as lymph nodes, bones, liver, lungs, or brain. Breast cancer can affect anyone, but the vast majority of cases occur in women. It is the most common cancer among women globally. Although the incidence in men is extremely low, accounting for only about 1% of all breast cancer cases, it still remains a health issue that should not be overlooked. There are several types of breast cancer depending on where the tumor originates, for instance, within the milk ducts or milk-producing lobules, lobular carcinoma. Furthermore, breast cancer is classified based on its invasiveness: non-invasive or early stage, localized or invasive, spread into surrounding tissues. It is important to understand that breast cancer is not merely a lump, but a complex biological process. It can be influenced by hormonal factors such as estrogen and progesterone, as well as genetic mutations like BRCA1 and BRCA2. Other risk factors include age, family history, lifestyle, diet, weight, and the use of hormone replacement therapy. Thanks to advances in modern medicine, breast cancer can now be detected early through screening methods such as mammograms, ultrasounds, and biopsies. It can be treated through various approaches, including surgery, chemotherapy, radiation therapy, hormone therapy, or targeted therapy. However, gaining a clear understanding of the nature of breast cancer remains the crucial first step toward prevention and taking control of one's health.
Although breast cancer is commonly perceived as a disease that primarily affects women, the truth is that anyone with breast tissue can develop breast cancer, including men. However, women account for over 99% of all diagnosed cases, due to having more breast tissue and higher levels of estrogen, a hormone known to fuel the growth of certain breast cancers. The risk of developing breast cancer increases with age, especially for women over the age of 40, and rises significantly after menopause. Women with a family history of breast or ovarian cancer, such as having a mother, sister, or daughter diagnosed with the disease, face a higher risk, especially if they carry inherited gene mutations like BRCA1 or BRCA2. Additionally, those who have had breast cancer in one breast or are also at risk of developing cancer in the other breast or experiencing recurrence. Importantly, breast cancer does not discriminate based on race, nationality, or social status. However, modern lifestyles, which often include high-fat diet, lack of physical activity, chronic stress, obesity, smoking, and alcohol consumption, have significantly contributed to an increase in breast cancer rates even among younger women. Furthermore, women who have never given birth later in life, not breastfed, or who use hormone replacement therapy for extended periods after menopause are also at greater risk than average. In men, although cases are rare, the disease is often diagnosed at a later stage, as few men consider themselves at risk. Older men, especially those exposed to prolonged estrogen levels, those with Klippner syndrome, or with a family history of breast cancer, should be particularly vigilant. In conclusion, everyone, regardless of gender or age, can potentially develop breast cancer, but individuals with the risk factors mentioned above should be especially cautious and proactive with regular screenings. Early detection remains the key to successful treatment and long-term survival. breast cancer does not arise without cause. It often develops as a result of various risk factors, some of which are beyond our control, while others relate closely to lifestyle choices. Understanding these factors is essential in assessing one's personal risk and taking preventative action where possible. One of the most significant risk factors is age. As individuals grow older, especially beyond the age of 50, the likelihood of developing breast cancer increases markedly. Gender is also a primary factor, with women being at far greater risk than men due to the influence of female hormones and the larger amount of breast tissue. Family history and genetics play a major role. People with close relatives, such as a mother, sister, or daughter, who have had breast or ovarian cancer are at a higher risk, especially if multiple family members have been affected. In particular, genetic mutations in the BRCA1 and BRCA2 genes can drastically increase the likelihood of breast cancer, and even lead to a higher risk of ovarian cancer as well. These mutations can be inherited and may warrant genetic testing for early monitoring. Hormone exposure is another key factor. Women who began menstruating early, before the age of 12, or experience menopause later, after age 55, are at higher risk because their bodies are exposed to estrogen for a longer duration. Similarly, women who have never given birth, had their first child after age 30, or did not breastfeed are also exposed to hormonal fluctuations that may increase cancer risk. Lifestyle-related factors are equally important. Obesity, particularly after menopause, is associated with a higher level of estrogen produced by fat tissue, which can fuel cancer growth. Lack of physical activity, poor diet, and excessive alcohol consumption also contribute to increased risk. Regular intake of alcohol, even in moderate amounts, has been shown to slightly raise the risk of breast cancer, while smoking, although more strongly linked to other cancers, may also play a supporting role. Additionally, long-term use of hormone replacement therapy, HRT, especially combined estrogen and progesterone therapy, has been associated with an elevated risk. Certain environmental exposures and even night shift work, which may disrupt melatonin production and the body's circadian rhythm, have been investigated as potential contributors, so research is still ongoing. In summary, while some risk factors for breast cancer, like age, genetics, and gender, cannot be changed, others related to lifestyle can be managed through conscious choices. A balanced diet, regular exercise, weight control, limiting alcohol, avoiding tobacco, and considering the risk of hormone therapy are all effective ways to reduce overall risk. Being informed and proactive is the first step in prevention.
In its early stages, breast cancer often does not cause pain and may develop silently, making it difficult for many people to detect until the disease has progressed. However, there are several important warning signs that everyone should be aware of, as early detection greatly increases the chances of successful treatment and long-term survival. The most common symptom is a lump or abnormal mass in the breast or underarm. This lump is typically painless, has irregular borders, and may feel immobile when touched. Although not all lumps are cancerous, any new or unusual lump should be examined by a healthcare professional as soon as possible. In addition to lumps, changes in the shape or size of the breast are also worth noting. One breast may become larger, sag, or look visibly different from the other. Changes in the nipple, such as inversion, hardening, shifting direction, or ulceration, can also be signs of abnormal growth beneath the surface. Another serious symptom is unusual discharge from the nipple, especially if the fluid is bloody, brown, or has a foul odor. While nipple discharge can occur for many reasons, any unexplained discharge, particularly from only one breast, warrants prompt medical evaluation. Changes in the skin texture of the breast area are also cause for concern. This may include puckering, dimpling, or a texture that resembles an orange peel, known as pédillage, as well as redness, itching, warmth, or thickening of the skin. These could indicate inflammatory breast cancer, a rare but aggressive form of the disease that requires urgent treatment. Additionally, persistent pain or tenderness in the breast, especially if not related to the menstrual cycle, or a heavy, tight feeling in the chest, should not be ignored. Notably, swelling or lumps in the armpit area may suggest that cancer cells have spread to the lymph nodes. In summary, although many symptoms of breast cancer can be mistaken for benign conditions such as hormonal changes or breast infections, being attentive to your body and seeking medical advice for any unusual changes is crucial. Early detection not only improves treatment outcomes, it can save your life or the life of someone you love.
Early detection of breast cancer plays a crucial role in successful treatment and greatly improves survival rates. In fact, when diagnosed at an early stage, breast cancer can have a survival rate of over 90%. That's why regular screening and monitoring are essential steps every woman, especially those over the age of 40, should take seriously. One of the simplest yet most effective methods is breast self-examination at home. This should be done monthly, ideally a few days after the menstrual period, when breast tissue is softer and less hormonally affected. During the exam, a woman gently feels both breasts and underarms for any lumps, hard spots, or unusual changes in shape, size, or skin texture. In addition to self-exams, clinical breast exams by a healthcare provider are equally important. A trained professional can detect subtle abnormalities that a person may overlook. These appointments also offer the opportunity to discuss personal risk factors and determine an appropriate screening schedule. The main imaging technique used today is mammography, a specialized X-ray that helps detect tiny changes or lesions in the breast that may not be visible or palpable. Mammograms can reveal cancer in its earliest stages before any physical symptoms appear, and are recommended annually or every 2 years for women age 40 and above, or earlier for those with high risk. If further evaluation is needed, breast ultrasound is often used in conjunction to better assess the nature of a lump, distinguishing between solid masses and fluid-filled cysts. In certain cases, magnetic resonance imaging, or MRI, is also employed, especially in women with dense breast tissue or those with a known BRCA gene mutation. Ultimately, the most definitive method of diagnosis is a breast biopsy, where a small sample of tissue is taken from the suspicious area and examined under a microscope. Biopsy results help determine not only whether the cells are cancerous, but also the type of breast cancer, the tumor grade, aggressiveness, and biological markers such as HER2, estrogen receptor, ER, and progesterone receptor, PR, status. These details are vital in crafting the most effective treatment plan. In summary, detecting and diagnosing breast cancer is not just about identifying a lump. It involves a comprehensive process of clinical evaluation, imaging, and histological analysis. By taking initiative with regular screenings and health checkups, individuals can significantly increase their chances of catching breast cancer early and improving their long-term outcomes.
Breast cancer is not a single disease, but rather a collection of distinct conditions, each with its own histological features, degree of aggressiveness, and responsiveness to treatment. Proper classification of breast cancer not only helps doctors predict the disease's progression, but also plays a vital role in tailoring an individualized treatment plan for each patient. Based on how far the cancer cells have spread, breast cancer is typically divided into two main categories: non-invasive, or in situ, and invasive. Non-invasive breast cancer, also known as carcinoma in situ, occurs when abnormal cells remain confined within the milk ducts or lobules and have not yet invaded surrounding tissues.
The most common type is ductal carcinoma in situ, or DCIS, which is considered an early-stage cancer with an excellent prognosis if detected and treated promptly. Another form is lobular carcinoma in situ, or LCIS, which is not true cancer but rather an indicator of increased risk for developing invasive breast cancer in the future. On the other hand, invasive breast cancer means that cancer cells have broken through the duct or lobular walls and invaded nearby breast tissue with the potential to spread to lymph nodes and distant organs. The two most common types are invasive ductal carcinoma, which accounts for approximately 70 to 80% of all cases, and invasive lobular carcinoma, which accounts for about 10%. These types are more dangerous and require timely, aggressive treatment. Beyond structural classification, modern medicine places increasing emphasis on the biological characteristics of the tumor cells, determined through tissue analysis and hormone receptor testing. There are three major subtypes in this category. The first is hormone receptor positive breast cancer, which tests positive for estrogen or progesterone. This type usually progresses more slowly and responds well to hormone therapy. The second is HER2 positive breast cancer, which involves the overexpression of the HER2 protein that stimulates rapid cancer cell growth. While this type can be more aggressive, it often responds well to targeted therapies like trastuzumab or Herceptin. The third type is triple-negative breast cancer, which lacks estrogen receptors, progesterone receptors, and HER2 expression. This subtype is more difficult to treat, tends to grow and spread faster, and has a higher risk of recurrence. It is more commonly found in younger women and certain ethnic groups, such as African American women. Another rare but extremely aggressive form is inflammatory breast cancer, which does not form a distinct lump but causes swelling, redness, heat, and thickened skin that resembles an orange peel. It progresses rapidly, is often misdiagnosed as an infection, and requires immediate and intensive treatment. Each type of breast cancer carries its own level of risk, treatment responsiveness, and potential for recurrence. Therefore, accurate classification at the time of diagnosis is critical, not only for choosing the right therapeutic approach, but also for giving patients and their families a clearer understanding of what lies ahead. Treating breast cancer is a complex and highly personalized process, depending on multiple factors, such as the stage of the disease, the type of breast cancer, the biological characteristics of the tumor, the overall health condition, and the patient's preferences. Thanks to the remarkable advances in modern medicine, there are now many effective treatment options available that not only prolong survival, but also improve the quality of life for those diagnosed with breast cancer. The most common and often first-line treatment is surgery, aimed at removing the tumor completely and preventing the spread of cancer cells. There are two main surgical approaches: breast-conserving surgery, lumpectomy, where only the tumor and a small margin of surrounding tissue are removed, and mastectomy, which involves removing the entire breast. In many cases, doctors also perform axillary lymph node dissection or sentinel lymph node biopsy to determine whether the cancer has spread to the lymphatic system. The surgical approach depends on the size and location of the tumor, as well as the patient's desire for cosmetic outcome. After surgery, radiation therapy is often recommended, especially for patients who choose breast-conserving surgery. Radiation uses high-energy beams to destroy any remaining cancer cells in the breast or nearby lymph nodes. It significantly reduces the risk of local recurrence and is typically administered over several weeks. Next is chemotherapy, which uses powerful drugs to kill cancer cells throughout the body. Chemotherapy is usually recommended when the cancer is aggressive, has spread beyond the breast, or when there is a high risk of recurrence. It can be given before surgery, neoadjuvant, to shrink the tumor, or after surgery, adjuvant, to eliminate any residual cancer cells. For patients whose tumors are hormone receptor positive, hormone therapy plays a vital role. Medications such as tamoxifen or aromatase inhibitors work by blocking the effects of estrogen, thereby slowing or halting the growth of hormone-sensitive cancer cells. This treatment typically continues for 5 to 10 years after the main treatment is completed. In cases where the tumor is HER2 positive, targeted therapy offers a major breakthrough. Drugs such as trastuzumab or Herceptin directly target the HER2 protein that promotes rapid cancer cell growth. Thanks to targeted therapy, survival outcomes for HER2-positive patients have improved dramatically. In recent years, immunotherapy has begun to emerge as a promising treatment, especially for triple-negative breast cancer. This approach helps the body's own immune system recognize and attack cancer cells more effectively, offering new hope for patients with hard-to-treat cancers. The choice of treatment is not a fixed protocol, but rather a flexible combination of methods, tailored to each individual case. Most importantly, patients should work closely with their medical team, maintain a positive mindset, and adopt a healthy lifestyle to achieve the best possible treatment outcomes. Breast cancer is one of the most common cancers affecting women worldwide. And while it is frightening, it does not mean a death sentence if detected and treated in time. Through decades of research and medical advancement, from simple surgeries to modern targeted therapies and immunotherapies, humanity has gradually turned breast cancer from an unnamed fear into a disease that can be managed and even overcome. However, the most important key still lies in the awareness and proactivity of each individual. Understanding what breast cancer is, who is at risk, the warning signs, how to detect it, and treatment options will give people a comprehensive view, removing vague fears and empowering them to protect themselves and their loved ones scientifically. Especially regular screenings, a healthy lifestyle, and a positive mindset not only help in prevention, but also increase the effectiveness of treatment if the disease does occur. Breast cancer does not choose its victims. It makes no distinction of age or life situation, but we can choose how to face it. With the support of modern medicine and an unyielding spirit, many women around the world have defeated cancer and gone on to live full, happy lives. So instead of being afraid, take action. Love your body by listening to it, taking care of it, and getting regular checkups. Sometimes life only truly begins when we dare to face what we fear the most.